I do. I have it on.
Oh, we have
Actually, I
to
don't.
start.
I'm looking at the site.
We have to enter. Oh, here we go. All right. Hello. We're ready.
Are we ready?
We're ready. Oh wait, it's a placeholder right now. So let's see what happens. Oh, there we are. Hello,
Hey,
everyone. I'm Rebecca. I'm
hey,
the director of marketing for Teachers Health Trust, and this is
Michael Skolnick. I'm CEO.
and
And
we're back for our next Facebook Live today, and we're so happy that you guys are here and we're able to do this for you. And today we have such a special show, and we'll talk about that in a minute. And as we get into this, I want to talk a little bit, Michael, about your experience with our first Facebook Live and why we're doing Facebook Live in the first place.
sure. Well, first of all, one of the things we really enjoy doing as a team is going to the schools, spending time with all the educators, understanding the problems, learn how we can repair anything that seems to be broken, work on any new ideas, innovate. And we can't just do that looking at ourselves. We need to be involved with our members. And this is a shelter in place period of time. And because of that, we believe we still need to communicate. And we're still communicating with some of the schools. We're having customer sessions. We are spending time and very much involved. But our goal here is to stay in touch with you. And Rebecca convinced me that Facebook Live is a good media for us to work in. I'm
Yeah.
not an expert in this space.
Well, we're all learning. So, absolutely. We love our Facebook page. We have some really fun, every member on there is engaged, and it's a wonderful channel and really a great opportunity to connect, share, listen, be present, be real, and just, learn more about what you, our members, need. And so, as you shared, we had a lot of really great ideas for 2020. We already had been in the schools. We were continuing to plan to go into schools, including town halls and just in real life events and all these neat things. And then with the pandemic, we shifted pretty quickly and are moving into channels such as Facebook Live so we can still engage and still connect as best we can during this really overwhelming and quite unprecedented time. So we are grateful for you for joining us today, and we look forward to doing more of these. And I think what we're planning on doing is maybe one or two shows a month, having special guests on, having real conversations, and getting questions from you. We got tons of questions submitted for our show today, which we're looking forward to sharing, and really just being present for you.
And
So,
we're doing this with topics that we believe are important, not just to come out there. And we're bringing these topics to you because if you understand your topics, it will help you more appropriately manage your health as you take advantage of Teachers Health Trust and all of the services and solutions that we have available. A lot
exactly.
of
And we
them
also,
are on the website, so make sure you spend time looking at that also.
and actually, one of the things we talk about a lot before we move into our main segment is that our members, like any person, many people are not as active in their healthcare unless if they're not feeling well, if they're unwell. And so one of the things we're really trying to do is encourage and help our members be engaged in their health plan always, know what your benefits are, be active in your healthcare. And so not just look it up when you need it, but be aware of it. So for if and when you need
Yeah, and
it.
also we want to let you know we're approachable, and if there are issues, that you're able to take care of those issues and actually get some results. And
Exactly.
we're here.
Well, on
And
that note, some of the things that we just launched recently, if you want to show that slide, is if you want to talk, we can talk quickly about open access, IPA. We have some neat new things that we've developed quickly to help our members before we move into our main show.
right, and if I don't see the slide right now, because for some reason or another, mine just went out. But either way, when you're
There it
sitting here at Facebook Live, you don't see the screen. Like,
We're doing our best here. We're definitely not professional Facebook Live.
but, but what we wanted to show you is that we are working effectively to try to support your needs with our pharmacy program. We have programs that are dealing with your customer service. What else is on there that's a slide, Rebecca?
We opened up enrollment again.
And we did. We opened up enrollment, and it's going to be basically open until July because we're hearing constantly that dependents are losing their benefits of some of our members who happen to be separate, and we want to give them an opportunity to join, or that people that were using their husband or wives benefits lost those, their husband or wife might have lost their job, and we want to make sure we offer you an opportunity.
There was like such a, we know as residents of Las Vegas, so many people have lost or been furloughed from their work. And so one of the amazing things about Teachers Health Trust is our premium is $0 for a member, for the subscriber, the teacher. So it's the dependents that.
I thought you were going to actually volunteer to pay a little bit more. And
I would do that. Well, we're working on our charitable partners. I'm trying hard. We're doing some great work with that. But yeah, I mean, we wanted to make sure that our members who maybe they're the subscriber and their dependents might have been on a spouse's plan, that if for any reason they did lose their coverage due to COVID impact, we could then bring them on. So,
and then we also have our IPA network,
brand
which is a new telehealth network locally that has only local physicians that are reaching out to our members. Average wait time goes anywhere from 30 seconds to a couple minutes. Right now, the MD Live telehealth program was there were 4.5-hour waits.
Yeah.
We responded, we called up physicians, we built a relationship that we think could be long lasting to the point where telehealth could be made local so you can work both from your telehealth platform, but also go into the office if needed.
Yeah, it's
so
a really
don't
great.
lose touch. Because remember, only half of our members even use primary care docs, and this gives you an opportunity to interact with doctors in the primary care community.
And we definitely want to provide more access to providers clearly during any time. In this case, it's challenging to go out into an office or out of one's home. So telehealth is such an incredible platform. It's only going to get better and develop more and more. But what Michael was just sharing, I love that you were saying how it's continuity of care. So if and when this is over and we get out and about, you can still keep your doctor that you established care with during this time. So, and then of course we have we worked really hard to develop a brand new mental health network, which is, kind of, huge deal, but that's what a segue into our show.
Well, the focus of the show is to deal with behavioral health, isolation, and other issues that happen with social distancing. I call it physical distancing, but if we're really looking at it as social distancing, that could be, catastrophic for many. So we wanted to talk about that today and bring some guests here who we believe are critical in supporting our program for behavioral health and actually lead it.
They are. Let's bring them on.
Let's bring them on. Jonathan? Oh, Jonathan disappeared.
Oh, there they are.
And Jonathan's looking like a physician with a tie. Look at him with his tie. And Jessica, who's wearing
my daughter picked it out. Had to wear it.
You look good. Donna's daughter picked it out. So we will bring on our special guest. Michael, if you wanted to introduce our guest, you just started, and we can talk a little bit about the topic of our show, which is incredibly important. And I'm looking forward myself to listening to what you have to speak about.
Yes. And let me know when the slides switch, since
we're ready.
I'm challenged. But anyway, first of all, I want to introduce you to Jessica Hennessy. And instead of me introducing her, I'm going to let her give about in your case, 30-second biography, because she could ramble on for a while.
Hi, everybody. Happy to be here today. So I'm Jessica Hennessy. I'm the Senior Vice President of Clinical Operations with Consumer Medical. And Consumer Medical is partnered with Teachers Health Trust to bring you treatment decision support for any and all conditions. We help manage and advise on the member call center as well. So happy to be here today. I'm a nurse practitioner by training, and I have a lot of background on behavioral health. So hoping that we can answer some of your questions and talk about how we can help you cope during this very stressful time.
And I want to add real clearly, she's been a big component in the development of our behavioral health program, which we hope is working a lot better for each one of you. And Jonathan, introduce yourself, Dr. Still.
My name is Jonathan Still. I'm a psychiatrist. Moved from Southern California to Las Vegas just over 10 years ago with my wife, who grew up in Green Valley. I live in Henderson. My daughter goes to Vanderburg Elementary School, has my wife's second grade teacher as her second grade teacher this year. And I'm a managing partner with a large group called Focus Mental Health Solutions, and we offer mental health treatment in a variety of settings, hospitals, and our outpatient clinics here locally. And I've been with Teachers Health Trust as the medical director for mental and behavioral health services since October of last year.
Thank you both for joining us today on our second show. And actually, this is our first THT produced show. So you are brave and we appreciate it. We're all in this together, literally. So thank you for joining us.
Getting me out of my comfort zone.
I think all of us.
Totally out of my comfort zone, so don't feel bad.
Okay,
I have my psychiatrist here, so I don't need.
We have our help here. So.
Armchair advice. Armchair advice.
All right.
So, are we at the first slide? Okay. So, COVID-19 has really changed our entire working environment. What we thought we couldn't do, which is work at home collaboratively and figure out how to build a social network at home and a work network, is reality. And we're making it happen the best that we can. I learned today that COVID-19, the first cases in the western part of the United States actually started to appear in mid-December, which was new to me, but I have personal story on that I could talk about later. But we're all under this physical distancing. But what I want to be real clear in is that I don't consider physical distancing social distancing. When you hear that comment, we're social distancing, does that send the wrong message? So I'm curious as to what either one of you think about that. And how does social distancing lead to isolation?
I think you're bringing up a good point. I think that it's one thing to be physically distant from the people that we care about, but we don't have to keep out of touch with people. We need to maintain as much connection as we can right now. And I think we could talk a little bit about how social connection or lack thereof kind of plays into people's struggles with depression and anxiety and other forms of mental health issues. But it's definitely something that we screen for. It's definitely a risk factor, and now we're all forced to do it. So we need to make sure that we're remaining as connected socially in this time of physical distancing.
Absolutely, I agree. And I think not only connected, with families to bring you closer, we talk about how the world moves so fast and this has made us slow down, but it's not just about the slowing down and appreciating sort of what that different lens has brought to the table, but figuring out different ways to connect, more meaningful ways to connect, and looking at Teacher Self-Trust as a partner in that connection, and why these Facebook Live, sessions are going to be critical, because we want to stay connected to you all and be able to know what you're facing. And for each one of you, that will be individually, so unique, but we're here to help and we're here to support you. So just know that we're all going through it together, and that connectedness goes just beyond your circle of family and friends that consider us a partner in that connection.
I know this is out of order of our presentation, but since you're saying that we're here to connect, can you talk about the access points, how teachers could reach behavioral health services? Are there any limitations?
I think I think what's important for me to kind of outline for people is why I got involved with this health plan. I was accepting Teachers Health Trust insurance at various facilities that I've worked at since residency after I moved here. And for such an important group of people in our community, a group that I'm very, very passionate about helping, it was very, very difficult for me as a psychiatrist who's primarily treating people, diagnosing and treating with medications. It's always very, very difficult to find our teachers the best resources in the community. It was a small network. It was a network that was filled with providers that oftentimes weren't taking new patients. And basically, it was a wild goose chase for anybody to try to get a psychotherapist or psychologist, a counselor, to be able to see them. And we had to address this issue. Access to mental health treatment needs to be free of barriers, because we need people to engage in mental health treatment before the worst symptoms arise. We need people to make it as preventative as possible. We need to get people in to see professionals when symptoms are mild, and then give them the right access points and engage them so that they know how to get the help that they need. So I feel like when we developed what is a brand new network for Teachers Health Trust, we went out and we found providers who have told us, and they know that when you take this insurance, you are going to get these people in. And we made that part of the goal. So we have a network that includes people that may have pretty crowded practices. So we've worked with Jessica and her staff to enable their staff to kind of pick up and do the heavy lifting and try to figure out where best to refer a person so that they're not looking around on their own.
So how is the access easier with what we have now, Jessica?
Well, I think having a dedicated number for behavioral health with trained professionals on the other end who understand the limitations of behavioral health and what the challenges that the teachers and the members are facing is very important. So our group is very well versed on the services that are available, the different levels of care. Dr. Still has done an amazing job at building a very robust network that is broken down by all different kinds of subspecialties within the behavioral health arena. So I think, from that standpoint, we want to take the burden off the members, right? Why we're removing the barriers. What we're offering by that dedicated line is a white glove service to allow for our health navigators to be able to communicate about what issues you are facing, assess those issues, and be able to then not just give you a list of names, but connect you, help you book the appointments. Behavioral health conditions can be debilitating. And if you're, for some reason not taking that preventative approach that Dr. Still talked about, and, doing this when it's become so debilitating, it's even hard to pick up the phone and make that first call and to reach out for help. So let us do the help for you. Let us help you along the way. And our navigators are tremendous, and they're persistent, and they will get you an appointment within the time frame that you need to be seen. And if you're encountering access issues, they have the ability to escalate things to Dr. Still, right to Michael, to be able to have quick resolutions, whether it's on a access point or on the other end of the claims, and from start to finish, they're there to help you along the way.
I think one thing to also recognize is that mental health systems and mental health networks are set up in a way that typically can almost worsen somebody's frustration and further their own anxiety and their own level of stress. And in many cases, I think uncertainty and generalized stress, right, leads to a lot of these psychiatric symptoms that most of us treat. When your primary care doctor refers you to an orthopedic surgeon to get your elbow looked at, there are not a whole number of different types of doctors you're going to go see. You're going to find an orthopedic surgeon. But when your primary care doctor says you need to go see somebody for some counseling, and all of a sudden you look in your benefits or your provider list and you see counselors, marriage and family therapists, licensed clinical social workers, psychologists, psychiatrists, most people throw their hands up, in many cases not really knowing who to see. So I think what we had to do was build in, like what Jessica said, a white glove service, somebody that can almost serve as a partner and an advocate for a member to get them to the person best equipped to help them.
Yes.
So
And we have that, to interject, we have on our website, we have a dedicated behavioral health section that you can find right in the nav bar in the under the for member menu. And in there, it does share a bit about the health navigators and how they really can guide you through to even coordinating that first appointment, because it is overwhelming, even determining what is wrong with me or how am I feeling. People don't know. So it's such a wonderful benefit and service that I actually have never heard of another plan doing. So I personally haven't heard that, but I think it's really amazing.
And we wanted it to be transparent too. Our entire behavioral health network is on the website. It's updated now, given the COVID-19 kind of scenario. Many of our providers are switching over to telehealth services, and it's going to be updated to include information about which providers are offering telehealth services. And again, Jessica's staff already, they know who's offering telehealth appointments for psychotherapy, for psychiatric medication management. So the resources are there. We just want people to feel comfortable reaching out.
So Jessica, do you scan the network to determine who has availability and open practice time each week so that we...
Absolutely. So what we do is we figure out the right level of care that you're looking for. So is it a family therapist? Is it a DBT therapist or a cognitive behavioral therapy? So what is it that they're looking for? And if they don't know what they're looking for, of course, the navigators can connect right to a nurse with behavioral health experience who can better assess the situation, especially if it's an escalating situation, and then make the determination of who is best to handle the situation, whether it be psychiatry or a therapeutic relationship, or sometimes both, and then go ahead and make those appointments, find the availability, give options, right? Because not everyone can make the first available appointment, and just, like I said, handhold the member through until there's resolution. All of our health navigators are committed to making sure that we get to a final resolution, not here's 3 numbers, let us know if you need additional help. It's let's connect right now to those 3 numbers and see if we encounter any barriers. When we've called and we encounter someone who may not be taking patients or has closed their practice, we raise that immediately to the credentialing team and to Dr. Still, so that we can determine if there's an access issue.
So Jonathan.
Yeah, I was going to say access issues in mental health have been rampant in Las Vegas. And to many extents, that's because of health plans and how health plans are run. And I think what we've really tried to do is remove as many barriers as possible.
So Jonathan.
Yeah.
I heard Jessica mention different types of providers.
Mm-hmm.
Before I get into a heavyweight question on the consequences of this pandemic, can you explain to us the different levels of providers and actually who should go to what type of provider?
Sure. So I think starting with medical providers, I'm a physician. I went through medical school. Psychiatry is a medical specialty, just like pediatrics, family practice, various forms of surgery. Psychiatrists typically are involved in making a correct diagnosis and designing an overall treatment plan. That treatment plan may or may not include prescribing of medication. So just because you go to see a psychiatrist doesn't mean you're going to be prescribed a medication. And by the way, you can elect to choose not to engage with medication management. You can choose to be referred to a psychotherapist. We also have physician's assistants that are trained in psychiatry that help doctors. We also have registered nurses who have gone through additional training to be able to prescribe medication and make correct diagnoses. All of these people are in our network. If your psychiatrist or your primary care doctor, or you just realize you need some kind of psychotherapy, some counseling, we have various types of counselors in our network. Most of these counselors are providing talk therapy, either individually, in a family group, or in a larger group. And really, what type of service they provide comes down to their type of training. So there are a lot of ways to get to a career in counseling. Some people go through and get a master's in marriage and family therapy. Some people go through social work graduate school, and some people go through training to become a psychologist. Talk therapy can be performed by any of these providers. Okay, So whether or not you need to see a medical doctor or a therapist typically involves how severe your symptoms are. I would say for the vast majority of people who are not experiencing a true functional impairment because of their mental health concern, can most of the time, and this isn't true all the time, but most of the time, can start with seeing a psychotherapist. Okay, one of those disciplines I just mentioned, because those people are also trained to refer to a doctor, right?
I get it, but what happens if somebody feels like they are almost suicidal and they're in a really traumatic circumstance? What do we have set up to be able to support that? I'll start with, well, either one of you can answer this.
Well, I mean, certainly in a time of crisis, evoking 911, a crisis hotline, if you have an existing provider, I think emergent and acute are very different. So if it's truly an emergency with suicidal ideation, the last thing you want to do is phone a friend. You need to get a trained crisis team to evaluate you, to determine if you can contract for safety or if you need a higher level of care. So safety first always. And I think being conservative about that is important. I don't know, Dr. Still, would you agree with that?
I mean, looking at an emergency first, if somebody's a danger to themselves, they're having suicidal thoughts, they're going through acute withdrawal from drugs or alcohol, and they need the type of service that's available in a hospital, that type of person should be calling 911. They can certainly call the dedicated mental health line, in which case they're going to be escalated up through your system, Jessica, to be routed to a local hospital. We have several inpatient psychiatric hospitals in our network here locally, and any emergency room or urgent care can also be of assistance. Okay, so an emergency is separated out, like you said, from like an acute issue or an urgency. I feel like an acute psychiatric issue that's affecting somebody's day-to-day functioning, sometimes involving a child or an adolescent patient not being able to go to school or an adult not being able to work. Those situations to me aren't quite an emergency, but that type of person needs help right now. I would usually prefer that type of person to see a doctor first, okay? Because that's obviously risen to the point where it's truly affecting somebody's functioning. And I want to also add, when somebody's not functioning, like I just described, that just doesn't affect them. It affects their entire family, okay? So it can cause psychiatric symptoms in other people too. So we need to make sure that people have easy access to getting the help that they need. It is almost always the case, though, that our psychiatrists are going to want their patients to see a psychotherapist or a counselor as well. So these disciplines tend to work in harmony.
So all large-scale disasters, whether they're traumatic, whether they're, like the World Trade Center, or natural, like hurricanes, or environmental, like the BP oil spill, are always accompanied by increases in depression, PTSD, substance abuse, etc. Actually, also domestic violence and other things that could impact anyone. I know after 911 that after 1 month following the attacks, 10% of New Yorkers were experiencing some form of depression. And in fact, about 25% of New Yorkers reported increased alcohol use after the attacks. My question is, what are the mental health consequences of a pandemic? Because this is different. And maybe you could speak on this from your perspective. And then after that, what are the steps? We have 3 steps we discussed. What are the 3 steps that we need to take to make sure that we're working with our members effectively? So first, tell us about pandemics.
I think that something you mentioned earlier, Jessica had mentioned this kind of concept, like, well, life is going to slow down. And there were a few days when people thought, well, I'm going to get more time with my family, or I'm going to, be able to do more things at home. And very quickly, people have come to understand that this situation brought on by COVID-19 is not going away anytime soon. Okay. The the quarantining and the social distancing has only been aimed at ensuring that our medical system doesn't get overwhelmed. We are likely going to have this disease around for quite a long time. Without intervention, most people with stress reach for unhealthy coping strategies. That's just what we do as human beings. And I think all of us at some point in time have engaged in a bad way of coping to a particular problem. The issue now, though, is that people can't get away from this issue. Okay, like if you've got a problem at home, work may become your refuge. Okay, you may be really passionate about your job or your role in the community, and you're able to, put your energy into that, and then maybe coming back home isn't as much of a stress, or vice versa, can be true as well. Right now, people are at home. Sometimes good relationships are stressed by too much interaction. Okay, people are separated from the things that they're passionate about. They're not able to make use of the healthier coping strategies that they may, that may in fact help them, like working out, gyms are closed, and all these things. So basically, I think of this situation as bringing on everybody in their homes all in a kind of a pressure cooker kind of a situation. And in my mind, I've never lived through anything like this, certainly as a doctor, that has made me think that I think more people are going to develop depression and anxiety and trauma-based symptoms as a result of what's going on now than anything we've been through in the past. I truly feel that way. And I think that only a matter of weeks into this, knowing that this is going to go on for quite a long time, it's really important for me to explain how our members get the help that they need. Because if you don't think you're going to need it now, you may need it at some point in the future. And we want to make sure you have the people in your lives, the doctors, the therapists, the people to support you, so that when things get worse, you have the resources you need.
Yeah, agreed. Couldn't agree anymore. But I will say that the stress and isolation that happens during this type of disease outbreak, it can manifest itself, not just in depression and anxiety, but those early warning signs that sleep patterns may be affected, or eating patterns, or difficulty sleeping or concentrating. It can start with very subtle signs of restlessness. And, like you mentioned, substance use increase, et cetera, unhealthy coping behaviors. If you see yourself going down the path of early warning signs, the time to get help is now, not waiting. I think that's the critical message that Dr. Still was, talking about, and I fully agree with.
And I don't want to be all doom and gloom about this either. I think that getting help from a mental health practitioner can be an extremely positive experience. Okay, people can start now in a time of great crisis, building a relationship with a psychologist or a counselor, or a doctor like me, that may last quite a long time. It could be like a positive, consistent person for you in your life, okay, and for your family as well, if you're doing like family counseling or couples therapy. And we just want to make sure that we continue to focus on getting people the help that they need.
Yeah, in preparation quick preparation for what happened with COVID-19, we said the first step for us to be able to work effectively as a plan was to prepare for the inevitability of loneliness and its consequences as we physically and socially isolate. How do you believe we've done that, and how effective has it been to date? Either one of you.
Yeah, I mean, combating loneliness, you talked about it as a step one, right? It's something you want to overcome. All of our typical social habits have been, and daily routines have been disrupted. So, promoting, like you said, having a buddy system and feeling like you're not alone, establishing those deeper connections. I think those are the things that we were talking about, and how to combat that, and certainly we can provide lots of strategies. So one of the other things that the navigators can do is, when connecting to a nurse, if you're having a hard time figuring out how you find your joy, how you regain a sense of routine and normalcy within the confines of what we're bound to do as social citizens, the nurses are trained to help you. If you want to try something new and you're like, I don't really know what brings me joy, what used to bring me joy is no longer here, and you're willing to explore some new things, the nurses are going to be wonderful at providing yoga kits and meditation kits and all kinds of new information that you can try, and all that is of no cost to Teachers Health Trust members.
And I don't think any of us knows has ever been through anything like this, okay? It's brand new. This is a completely new type of situation. People are not at work, they're at home in roles that they wouldn't ordinarily be doing during the day. I'm seeing that a lot of my patients, new patients that are suffering because of issues coming up just recently, and my already existing patients, because I do quite a bit of outpatient treatment, are coming in with a sense that they don't have their own time. Okay, people don't feel like they are able to devote any amount of time during the day to their own mental and physical wellness. So sometimes it can be really, really hard to initiate good changes, okay, or adopt new practices and new routines, like Jessica said, without guidance and without support. So you may think of psychotherapy as something you've heard about that people do when they're unable to go out of their house and they're extremely depressed and they're maybe feeling suicidal. But what happens if somebody's just trying to adjust to a new type of situation and needs some coaching, needs some help structuring the change that they want to make happen in their lives? And I think that that's an excellent reason to seek treatment. It doesn't have to be for a problem that in your mind is something that's an emergency, okay? It can just be that your mental health provider is somebody to support you in making the changes that are going to make you healthier, both physically and mentally, hopefully.
What about when we talk about monitoring, which was step 2 we discussed, being ready to monitor and respond? What mechanisms do we have in place that allow us to intervene and get involved proactively?
You're saying as members or as a health plan?
As a health plan with our members, yes.
Well, I tend to be in the loop on anybody that's receiving any sort of more acute or emergent treatment in our network. So for certainly we hope we don't have too many people who end up, like, let's say, in a psychiatric hospital because of this. We know we will, though, and we're very prepared to be able to treat those members as appropriately as possible. But I want to make sure that everybody that ends up in a place like that has excellent outpatient care when they leave, and that every step of that process has been developed in kind of a more personalized manner that's driven to help them with their particular situation. I've never really seen. Health plans treat populations, but I treat individuals. So I want to make sure that we treat everybody as an individual.
We know that patients, they are members that have multiple chronic conditions that are a little less able to get around, could potentially become, frightened, impacted, and negatively, and it could impact their overall chronic condition negatively. I just give you some proactive work we've done to be able to support our programs and to refer people to mental health. We actually have a nurse practitioner, Tina Meeks, that called 311 of our top members when it comes to cost, conditions, and who need the most care right now. And we've been working with them, staying in touch, channeling information back and forth to their providers, and trying to build an interactive and preventive process so people don't end up in the ER during this COVID circumstance, and that people do feel like they're being taken care of and managed through their health conditions. have you seen any ways that that has impacted members that you've seen, or have you felt that the impact of what we've done?
I think, I mean, for my patients, the people that I've seen, the single biggest effect that I've seen has been because of this rollout of telehealth initiatives. Okay, I mean, I think that it's enabled people to access care who wouldn't have accessed care before. I mean, I think that's been a huge positive. So, and I think we should probably talk about that now. I mean, if you want to.
And also just to say too that all of Teachers Health Trust telehealth visits, whether it's clinical through therapy, are free. The copay is $0. So I think that's a really important thing to note as well.
I mean, there are a lot of reasons why telehealth wasn't more routinely adopted as a way of doctors seeing patients and therapists seeing patients. There have been steps taken by the federal government to relax restrictions on telehealth services. So like I said, I'm a partner at Focus Mental Health Solutions. We have a large outpatient practice, and we see a lot of Teachers Health Trust members. I think it was actually even prior to the governor putting this shelter-in-place order out or recommendation out that we switched over to telehealth services as a way of seeing our patients, both new and existing patients, because we felt like as providers, we had to stay healthy too. It doesn't help anybody if we're getting sick and not able to see the patients that we need to be able to see. So we switched very, very quickly to telehealth. And I think the majority of the larger providers in our behavioral health network have done the same. There's been some frustration among members. I have a pretty hands-on approach. I hear about people's frustrations with certain types of service. So for example, if somebody needs psychological testing or a diagnostic test for attention deficit disorder or a diagnostic test for autism, those are things that oftentimes have to be done in a clinic with the trained professional you're working with the psychologist. So it isn't that every service is available via telehealth, but certainly all traditional and group psychotherapy services can be done via telehealth, which is amazing. There are people in our network doing groups for teens, groups for adults, all via like Zoom meetings and other online platforms that are really, really easy for members to use. And most of the offices I work with are orienting their potential patients to how to use the software. So at Focus, we walk somebody through how to download the app that we use. It's all HIPAA compliant. It's fully integrated into their medical record, and it's working really, really well. So,
Anything you want to add to that, Jessica?
No, I mean, I think that covers it. I do have concerns about people that have, baseline comorbidities, especially medical comorbidities that you mentioned that Tina, reached out to those members. Certainly consumer medical can also help those members identify their risk. We know there's a lot of members right now that have a diagnosis of cancer or might be immunocompromised. And we're helping those members try to figure out with their treating physicians how to mitigate their risk.
And then I believe we had a third step we discussed, which was building our services and programs to basically support and create that outreach. We've been talking about that since the beginning. However, because we have limited time, we have a lot of questions that we've received from people listening now and members who have sent those in. So I'd like to see if we could address some of their independent questions at this point.
Yeah, we sent out communications to all 19,000 of you. We got some great questions about mental health. Thank you for sharing and submitting and wanting to be part of this narrative. So we'll just ask a few questions, and beyond this Q&A right now, we always encourage you, our members, to contact us for any question about the health plan or your care. So this was a question, and we provide access and resources as much as possible, but we know our members, some people are unable to find what they need. So Jonathan, I'll shoot this your way.
Sure.
Where can our members get connected? How with the behavioral health specialist?
I think the easiest thing to do, unless you know of a provider in our network, okay, so some people know of a provider in our network that maybe a family member is seeing or a friend is seeing, you can definitely call that provider, right? The problem with that is that you may not be able to get an appointment quick enough. And the reason we have a dedicated behavioral health line is so you can put that onto someone else whose only job it is to help you negotiate our network and find a provider that can see you as quick as possible. So generally, I would much prefer people call that dedicated behavioral health number because I think that it's a way that you may be able to get all of your appointments made for you. So if you call that number and you say, I really need to see a psychiatrist, I moved from out of the area, I'm already taking some medication because I have depression or panic disorder, and I also need a psychotherapist, that health navigator can set those appointments up for you all at the same time. So you don't have to run around, look through a directory, call a bunch of clinics. We just want to make it easy for people. I mean, everybody's busy, nobody has enough time.
And you
We
can
all
find
do things to
that
be
right on
efficient.
our website. Yeah, and you can find that information right on our website.
Right on the website.
Bar, in the contact page. It's also on the back of your health card. You can also find the number as well. So we want to follow up, Michael?
Ask Jessica. It's a question we hit on, but it's a question that people are still asking, even as we sit here and look at some of the comments, is how do I feel good when there's so much isolation?
Yeah, such a tricky question because it's such an individualized question, but I did come up with a little bit of list of, little things. I look at it in very small goals. I think if I go to say, well, I'm going to change my eating habits and I'm going to get more exercise, and those are just giant leaps and a lot to ask a member. So I like to say baby steps, come up, celebrate the small wins, and that's a good place to start. So definitely taking a break from watching the news. I think news tend to be sensational. There's a lot of political comment right now that is tainting some of the evidence-based information that's out there. So taking a break from that, I think taking care of your body, whether that means deep breaths, stretching, meditation, exercise, a walk, changing your environment. Today you work by a window and tomorrow, you work by, a fireplace. So making time to unwind. So really setting your calendar, like keeping to a schedule. It's funny because today I said, oh my God, I have to get up and shower first thing in the morning and get dressed and put on makeup so I could be presentable for all of you today. And that changed my routine of being in a ponytail and hanging around in my sweats. So, it definitely felt good that I was like, oh, this feels more like myself. Just even things like that. I would say connect with non-humans. I saw Rebecca's four-legged friend pop into the picture, and I think our pets can be an amazing source of comfort. So those are some of the things that people can do. And like I said, if you don't have ideas of what appeals to you, chat with our nurses. They're full of ideas. They've got lots of different coping mechanisms. They're experiencing it themselves, so it's not foreign to them.
I love the idea also as a parent, like this idea of like small wins. I think that's really important to remember. And then I like to follow up with Jonathan, and we did speak about this, but we get this asked quite a bit. There's two questions here, which are basically the same, which is why is it hard to find providers that are in the network and are accepting new patients? Finding a mental health professional that can provide medication and talk therapy feels impossible. And then a similar question was, we have very few mental health providers in Clark County who are taking THT. We need more access to online providers. So if you want to speak a bit about.
So I think we can look at we've looked at our network. We certainly don't have any access issues now. So the question of I think you asked one question involving why can't we find any providers that are taking new patients? That's the reason I want people to call this dedicated behavioral health line, because we know the practices that are taking new patients. Okay, we've made steps to engage practices that have a lot of clinicians, okay, and a lot of availability, and we've worked with those practices on what they do to help get our members in quickly. Okay, it is true that if somebody has taken Teachers Health Trust as a psychotherapist for 10 years, okay? That person may not have taken on a new patient in months, okay? That doesn't mean that they're not in our network. It just means that they're not taking new patients. And we like to update our directory with who's not taking new patients when we hear about it. But if you start, as a member, just start calling people in the directory, you may end up finding by just luck that you end up with a provider that's taking new patients or end up with a provider that's not. I think it's really important to access the help that we're providing, almost as like a concierge approach, really, because it's always completely unnerved me when I call for a doctor like I call my health plan for a doctor and I get 10 names and I have to go call them all. I think it's just a ridiculous process for people that are really busy, and we know our teachers are busy. They have too little time, and when they get home, they're still doing work, okay? And then they have, their home lives as well. So I think that there have been access issues. If people go about it on their own, they're likely to encounter access issues. We know that there are providers taking patients like with same-day appointments. And certainly with this telehealth rollout, many of our providers have seen a drop-off in utilization because a lot of people have canceled appointments. They don't want to come in. So if you find that you want a telehealth appointment, and we think you should take advantage of this service that a lot of providers are enabling you to do, there really isn't a problem getting in to see somebody. Okay.
So I have a question that relates to that. I think you need to answer it. Somebody said, I've been seeing a psychiatrist for 5 years, and all of a sudden they will not see me without a referral. Is this true? The reason I'm asking is that my primary care physician is not faxing over the referral, and I'm running out of meds at the end of this month.
I think it's a really good question. So primary care, so internal medicine, family medicine, OBGYN physicians, and psychiatrists, okay, we are all considered primary care. You do not need a referral to see any of those providers. It's by law, from what I understand. A health plan cannot put a gatekeeper in front of accessing mental health treatment. You don't need a referral to see a therapist. You don't need a referral to see a psychiatrist. Okay.
You might need to go check out your primary care physician if they're putting these rules and regs in place.
I think it's a very good point. There are providers that will have to seek approval for certain services from a healthcare plan, but you can go see that provider and have an evaluation.
Okay, this is a really good question. I want to ask this, but it's how can we get mental health that is crisis for a teacher, but not lock me in the loony bin crisis?
Lock you in the loony bin. Okay. So every state has a legal mechanism to put somebody on an involuntary hold for a mental health emergency. Okay. You have to be a danger to yourself, literally a danger, an imminent danger to yourself. You have to be a danger to others, or you have to be so impaired that you can't take care of yourself. Those are the only reasons we can involuntarily put somebody in a hospital. Okay. There are actually very few instances that somebody ends up needing to be hospitalized. Most of the time in outpatient treatment, we can help somebody in an outpatient setting. So I think what your question really alludes to in my mind is that there's still a lot of stigma about what mental health problems are, okay? Medically, whether or not they're a disease, whether or not it's our fault, whether or not we're not strong enough, and whether or not seeking mental health treatment means that we're quote unquote crazy, that we can't handle things. And a lot of these notions are put into our minds because of our families, okay? The media, and just there's been generally I would say like a mistreatment of mental health problems for millennia. So I think I don't want anybody, certainly any of our members, any of our teachers, to feel that reaching out for help means that they're going to lose control of their situation. We want to improve their sense of control. Okay, not having control is what we have because of COVID-19. Okay, we can't control what is going to happen with this thing. We can control the way we react to it, and we can control what we do to help ourselves. Okay. So I hate removing a patient's rights and having to put them in a hospital. Thankfully, I almost never need to do that. There was a question Rebecca asked about why can't I find a provider to see for both medication and psychotherapy? I think that's a really good question. It used to be that psychiatrists prescribed medication, did diagnosis, treatment, and did psychotherapy. Most of the time now we have a split model of mental health treatment. That's been the way it's been this way for probably 20 or 30 years. Most people see a doctor and then see a separate therapist. And what is key is that your doctor or mental health provider, if it's a nurse practitioner or a PA, works directly with your therapist. So I highly encourage there to be releases of information signed between offices, which you can do, and have your therapist speak to your doctor. That's going to make sure you get the best treatment. And anybody that doesn't want to speak to your doctor, or a doctor that doesn't want to speak with your therapist, you probably should be seeing somebody else.
Collaboration is critical to align goals and really discuss best treatment options.
Absolutely.
How often do the two of you talk to each other each day as part of this collaboration?
I love working with Jessica. I don't think we talk every day. We email most days.
Yeah.
Jessica.
I have a bad phone to Jonathan.
Yeah. So I have a very personal approach with most. I've worked with other health plans too. I like to address problems. It actually makes me feel really, really good to fix problems. I know I can't fix every problem, but I know how to get people to the right type of provider. And when there are barriers, either real or perceived, I get a call from Jessica. I may get a call from Dr. Jacobs, our other medical director. We address issues at the highest level right away. We've addressed issues for our providers. We've addressed issues for our members, their members' families. We want to be as flexible as possible and as, reactive as possible to what people are needing,
I love that. I want to do one more quick question and then we do have to wrap up soon. And this one is for Michael. Someone asked about it, and I'm sure this kind of leans on the anxiety of it all, but will there be COVID-19 testing prior for any teachers returning to work? Do we know anything about this at this time?
Yeah, we're working very intensely on developing a testing program. We're in the process now of trying to make it effective, but actually have meetings so people know where they stand. Our goal is to be able to get teachers to be able to go back to work and a certification that says they can, but in a patient protective equipment environment with classes that aren't overfilling with students that could actually put people at risk, and developing a good program to allow for re-entry into the schools. We are working with a major lab, a national lab, that's supporting this, and more to come. In fact, I'm hoping within the next 2 weeks when we do our next Facebook Live, we could address re-entering and what that means and how do we re-enter, and do we ever get normal back? Because that might never come. But
how a lot harder to reopen than it is to close.
You can just say open up, but that's not going to lead to the second wave of this pandemic. We want to do it correctly.
And well, so that is definitely going to be really, really exciting to hear more about. I know our team and all of our benefit partners work so hard to swiftly adapt to our new surroundings and kind of this uncharted time. So I just wanted to wrap this up quickly out, with my sincere thank you to Jonathan and Jessica for joining us and always being with us. I'm doing these with you, and Michael. I think this is so just to listen and to hear I'm a member as well. So I think it's really special. And thank you, of course, for your time, Michael, as well. And before we wrap up, we want to share an update on a really special partnership we have.
So we have 2 special partnerships. I don't see the slides.
Coming up.
But the first partnership is with Serving Our Kids. our pharmacy team, along with our pharmacy company that we partner with, Alto, have teamed up with Serving Our Kids to deliver meals to students and young students who have not been able to get their weekend food that they were normally getting from Serving Our Kids delivered. And we've delivered at this point close to 620 meals. I just want to thank Alto and Sarah, who's been managing that program from THT, just immensely. This is such a good program to help 680 meals get delivered. And this has only been a few weeks. That's
Or
and then the second thing we're working on, and we're just investing in, is the mask program. What is the name of that program?
task force. It's powered by the Las Vegas Fashion Council, and we are making a donation to them to create and distribute masks to our teachers. They're also doing mask builds, and they're sewing them quickly and sending them off to frontline responders and people in need and food servers. So they're doing a really fantastic job for our city to get masks out there. I know a lot of programs are doing that. So I think it's really exciting that there's even more in our city to help, especially our teachers. So if and when they need them, they're available.
And
So
actually, I want to reach out to all of the teachers that are watching this, any of the schools, and let you know that we are open to meet with any school, any group of people using this media type, not Facebook Live, but by using Zoom, which I know the schools aren't allowed to use, but we have secure Zoom, and we can use that with the teachers and have one-on-one or one-on-20 or one-on-50 discussions.
yeah, continuing our in-school presentations just to take you through what your health plan is. I mean, we had been doing those, and we already have a few set up in the next week or two. So please reach out to us. We're here to always talk with you. So just as a final wrap up for our members, we talked about a lot of things. We're going to show a few slides, but please know you can always access our website. So just for our members, we have a dedicated phone number just for behavioral health. We talked about it a few times, so we'll show the slide real quickly. And you can find this number on the back of your health card. You can find it on the website, in the contact section, in the behavioral health section. So please bookmark this, use it as much, and if you need to share it with someone, please do. We also have a dedicated website section, and we also have a dedicated website, actually a directory just for behavioral health. So if you want to look through doctors' names as you're talking with the health navigator and ally, you certainly can. And that is on our directory page. And you can find that at in the nav bar as well. And then, of course, we have our behavioral site section, which I mentioned, so we can see that slide, and that's just teachershealthtrust.org/behavioral health. And then, of course, as I've shared a few times, and we're always trying to let our members know, please use our website. We build it for you. It's updated all the time. It's real time. We have a lot of messages on there. All your contact information is there. So we really encourage you to use that. And then our next slide, let's see. I think this is our key contacts. We designed a very quick download for you with key contacts, what it is, phone numbers, emails, and then contact information. So you can just access that on the website as well. You all have received an email with this last week as well. Of course, you can download your benefits guide. It's a snapshot of your health plan for 2020 that lives on the benefits page. There you will also find other key benefits such as IPA Health Network, which is our local telehealth network. We have MD Live, our national one. And then we have a suite of benefits through Consumer Medical, actually. If you want to go to that next slide, please. We have really neat, at no additional cost to you, so you can contact them directly. It's surgery decision support, medical decision support, second opinion enrollment. So there's some really exciting and important benefits for you there. And then finally, I think this is one of our last slides. We would love for you to follow along. We have a text message platform. We have almost, gosh, I think 2,000 members are already signed up. Please sign up. It's free. Just text THT member to 484848, and we send text messages infrequently, really essential ones. So please sign up for real-time communications and then follow along. Obviously, if you're listening, you're on our Facebook, but we are on Twitter and Instagram as well, just THT Health Plan. So there's a lot of ways to find us. We want to hear from you. We are hearing from you on all of these channels. And we just once again want to thank our guests for joining us today.
Thanks for having us.
Yeah, thanks for
Our
having me.
East Coast guest stayed up late for us.
Yeah.
Yeah, thanks for doing a great job, Rebecca, too. Thank you.
Thank you. Appreciate that. And we will join, we're going to come up with our next Facebook Live soon, and we will be in touch with everyone. And we look forward to any feedback, anything you want to hear. And we want you all to take care of yourselves.
Stay healthy, everybody.
Yeah, stay
Thank you.
safe, stay strong.